that's where the numbers come in. It's like if they have a big enough list, I mean, you could do it with any list, but to really see a big influx, a 90-day campaign, it's like a patient list of 1,000. And then it's nurturing them. It's looking at, first basic hygiene reactivation. A lot of patients haven't come back since COVID, and they haven't got into the swing of things again. So making sure that the hygiene is humming and the communication with their patients is kind of just next level. Let's level up that communication with them. It's not just, you're doing 6 months, come in for your cleaning. No, we want to, build that relationship, have fun with them. Put a little surprise, delight, and wow when they're coming in there to build those relationships up, because that's where referrals come from. And then, so once we kind of clean up and make sure that the hygiene is super healthy, that's usually a huge influx of cash. I mean, we have results, and the beautiful thing about that is there's no ad spend, right? And then it's looking at treatment acceptance, like who hasn't accepted their treatment plans, concentrating on, the crowns, the Invisalign, that can bring in a massive amount of cash into the practice right away. But you have to speak to those patients in a way that's connection, in a way that's building up, in a way that's like just short and sweet, fun. They have to have a little carrot, a little offer, gift voucher, this or the, to get them in. Kind of got that worked down, but that's a huge influx, is looking at the low hanging fruit of these practices, because they've already done so much to build up relationship. When they're in these practices, because we just have this high caliber of practices that we've worked with over the last 23 years, is they've done the work when they're in there, but they have not nurtured those relationships enough. So if we can get back in there and nurture them properly and speak to them how people need to be spoken to, they can get a massive amount of influx in cash. And the beautiful thing about this is what we're seeing is now that they're like, okay, now I want to grow. Now I want to do more dental implants. Great, let's do new leads. Let's do Google ads. But now this big influx of cash, we're playing with house money here, right? Because we've gotten it from the practice and we got some house money extra over here. Let's do some dental implant ads. Let's do some Invisalign ads over here, right? And so that's where it can really grow. And a lot of them are using those cashes to update their website, because it's been forever and the branding is just bad. So now that we've made sure that the practice is healthy and they're getting this cash in, now they need to look at their brand. Now they need to look at their website, because it is very competitive out there, but we've paid for it through this influx of cash, or this low hanging fruit that we've done over the past 90 days. I would say 2 campaigns, 3 campaigns to really get them humming.